Good day, class. Sorry for the delay. In the previous video lecture, we discussed all the DNA viruses, and this video lecture we will try to cover your RNA viruses, and we will start with your group 3 and your group 4. So for the learning objectives of this video lecture and the remaining video lectures that we have, class, for the RNA viruses, first we are able to enumerate the different families of RNA viruses classified based on the Baltimore's classification scheme. Second is to illustrate the significance of an RNA virus to human health, community, and in the current healthcare setting. And third, will be describe the appropriate methods for the diagnosis of diseases associated with RNA viruses since we are a medical laboratory scientist. Okay, so we'll discuss now your Baltimore classification group number 3. And this is very short kasi isa lang yung virus na i-discuss natin under this one. Group 3 Baltimore's classification are non-enveloped segmented double-stranded RNA viruses. Under this one is your Rio viruses. Under Rio viruses naman, class, we will only discuss one clinically significant virus, which is your rotavirus. So rotavirus are naked, so therefore, class, they don't have envelope. They're very small, around 75 nanometer in diameter, with two proteins layers surrounding the capsid. Take note, class, that the protein surrounding the capsid is not a envelope because the envelope characteristic should be a lipid form. Most rotaviruses are most common cause of viral gastroenteritis in infant and children. Please pakitake note ito, class. Kung lalabas sa exam, sino yung most common cause of viral gastroenteritis in infants and children? We have your rotavirus. Yung kagandahan lang ni rotavirus, class, kasi isa siya sa mga segmented. So, ano ibig sabihin ng segmented, class? So, if you can observe this one, class, meron siyang 11 segments of your double-stranded RNA, class. Okay? Count natin, class, so you have this one. Okay, 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So, meron tayong 11 segments. Okay? Meron tayong 11 segments ng ng double-stranded RNA class. Okay? Tandaan, iilan lang yung mga segmented na viruses at isa doon si rotavirus. So rotavirus spread by oral fecal route and have an incubation period of 1 to 4 days. As we define the term incubation period, it is the period between the infection of an individual by a pathogen, in this case rotavirus and or any viruses class, and the manifestation of the illness or disease. So ano ibig sabihin, class? If you accidentally ingest a contaminated food and or water containing rotavirus, so yung rotavirus class will take time 1 to 4 days before it will cause manifestation. So ano yung mga manifestation niya, class? So manifestation those are symptoms. So symptoms including vomiting, diarrhea, fever, and in some cases abdominal pain and respiratory symptoms. So the virus is shed in large quantities in the stool and can cause nosocomial outbreak in the absence of good hygiene. So if you can observe in the picture, class, this is rotavirus particle with the viral protein 4. And this viral protein 4 class or VP4 proteins attach the virus to the epithelial lining in the gut. So this is what we call viral tropism, class, because the viral component VP4 is able to contact and or attach to your epithelial cell linings. And then after that one, the virus is able to enter the cell and then produce toxins. And then after that one, class, they will try to replicate and multiply, then producing a large amount of or quantities of virus in the stool. So for the diagnostic tools, we can actually use your enzyme-linked immunosorbent assay. As I always mention that this is explained already with your serology. You can also use your latex agglutination test, viral antigens in the fecal material. So sa latex agglutination test naman class, pakitandaan class na ang ano natin is viral antigen. Okay, pakitandaan class na ang ano natin is viral antigen. Okay, highlight ko na to class ha, yung viral antigens yung ano natin. Okay, ito yung unknown. Okay, pag sinabing unknown class, ito yung kailangan nating hanapin. Okay, so therefore class, kung gagamit tayo ng latex agglutination test, yung particle natin dapat merong particle na embedded with your antibody because your antibody will bind to your viral antigen, okay, causing your agglutination. With your enzyme-linked immunosorbent assay naman din class, KD, ano naman natin, class is viral antigen. Take note in the previous slide class na malaki yung quantities na sineshed sa stool na virus. So virus are proteins, so therefore, they are antigens. Then, ang kailangan natin gamitin sa kit natin class, specifically your enzyme-linked immunosorbent assay should be antibodies. We can also use your electron microscopy for examination class, but not sensitive. So since the virus is very common to infant and children, vaccine is actually provided already class and made. So we have your human bovine rotavirus vaccine. It was actually produced in 2006. Up to now, developed countries use rotavirus vaccine. But for underdeveloped countries and third world countries like Philippines, there are very rare number of vaccines for the rotavirus. And we are done with your Group 3 or Baltimore's classification, Group 3. Then we will proceed to your Baltimore classification, Group number 4 class. Okay? So, under your Group number 4, isa sa mga pinakasikat na virus dyan class is your polio. If you can recognize Dr. Jonas Salk, so si Dr. Jonas Salk yung nag-create at saka nag-invent naman ng Salk vaccine class. Okay? Salk vaccine for your polio vaccine. So, during his time class, sabi pa ng mga tao at sa mga hindi naniniwala sa vaccine that Salk vaccine is not safe, it's not effective, etc. So, ang sabi lang naman ni Dr. Jonas Salk, risk, I like to say. So, always pay off. You learn what to do or what not to do. So, we cannot actually know the future class if we don't take the risk. So, what Dr. Jonas Salk was trying to imply to the people class that we will never know if kung may side effect yung vaccine o wala. So, how should we know? So, we need to take risks. And polio is now eliminated in the world. And then there are some recurring cases of polio because of the vaccine, but we'll talk that one on the other discussions in our presentations class. So, we will discuss the non-enveloped single-celled RNA viruses, which is your Picornaviridae class. Ayan, ganda kasi Picornaviridae. So, for Picornaviridae class, kung hahatiin na i-dissect natin to class, you have your Pico. Okay, you have your Pico. Okay, Pico is a Latin. I think it's a Latin word class. Okay, I'm not sure. Paki-double check Latin or Greek word for small. Okay, small. Hindi mabasa class. Small. Ayan. Sorry. Yan, small class. K Pico or Pico, which is small. Small what class? Anong genome characteristic niya? RNA. Okay. And then you have your Viridae family. Okay. It's a family of virus class. It's a family of RNA viruses that are small or pico. Yan. Kaya siya sinabing Picornaviridae. Okay, Picornaviridae is one of the largest families of viruses with more than 230 members. But don't worry, class, we'll not discuss all the 230 members. We'll only touch those clinically significant and yung usual na or possible na lalabas sa board exam. So it contains many important human and animal pathogens, as I mentioned earlier. So they are very small. Imagine class, they are only 27 nanometer class. So imagine that one. They're very small. Okay? And then, so since they are non-enveloped, so they are naked, so wala tayong makikita peplos gas. Okay? So if you can observe in the picture, so you have your capsid. Okay, a set of your capsid, you have your capsomeres, and then you have your single-stranded RNA. Uh, konting ano lang siya class, mahaba siya konti kasi nasa 7,478 bases siya. And then you have your VPG. We'll discuss the VPG pagdating natin sa ano class, molecular diagnosis in viral infections. So among all the viruses under your Picornaviridae class, we will only touch 4 genera with human clinical significance. Okay, and yung apat na yun class, we have your enteroviruses, you have your rhinoviruses, hepatoviruses, and then you have your Paricoviruses. For enteroviruses class, the enteroviruses found in genus include, you have your poliovirus 1, 2, and 3. You also have your Coxsackie-virus A1 through 23. Ayan, madami konti class. Coxsackie-virus B1 through 6. Enterovirus 68 and 72 through 72. Echovirus 1 to 32. And Paricovirus 1 to 4. Okay, so these are viruses that are under the 4 genera na have human clinical significance class. So for enteroviruses class, they are small, naked, as we mentioned earlier that picornaviruses are naked viruses or non-enveloped, and cause various conditions including fever of unknown origin, aseptic meningitis. Ayan, na-discuss naman natin to class ha, kung bakit siya tinawag na aseptic. Sorry class, bakit siya tinawag na aseptic? Kasi class, tinawag siya na aseptic kasi pag try na ng culture sa bacteria, for bacterial meningitis, walang growth. So, hindi bacteria. Okay? Tapos, anong next? Hindi naman fungi. Kasi wala ding tumubo na fungi, kaya siya tinawag na aseptic. Okay? Or clean. Kasi walang growth sa culture media. Okay? Kaya siya tinawag na aseptic meningitis. Their viruses can also cause paralysis, cardiomyopathy, exanthemas, and pharyngitis. And, of course, you have your conjunctivitis class. If you can see in the picture, you have your enteroviral hemorrhagic conjunctivitis. So, infections are more prevalent in areas with poverty, overcrowding, poor hygiene, and poor sanitation. So, if you can observe the denominator of this characteristic class is that the mode of transmission, if it's too close contact, you can easily transmit it to other people. So for the mode of transmission for enterovirus class, we have aerosol, and or we can have your fecal oral route and fomites. Okay, the portal of entry is the alimentary canal via your mouth. So the viruses replicate initially in the lymphoid tissue of the pharynx and gut. So therefore, class, if you can observe and can remember during your elementary days nung nag-polio vaccine ka, 'di ba? Ano yung parang orange tapos nilalagay sa ilalim ng dila and or pinapatak. Okay? That type of vaccine class is not Salk vaccine. Bakit? Kasi ang alam natin about Salk vaccine class is injected siya. Okay? Injected siya class, so therefore intramuscularly. Compare with your Sabin vaccine. Yung Sabin vaccine kasi given orally. So, bakit siya given orally class? Yung Sabin kasi is attenuated vaccine. So, anong ibig sabihin ng attenuated vaccine class? Pinahinang version ng virus. So, kung pinahinang version ng virus, so dapat, therefore, yung mode of initiation niya is hindi dapat intramuscular, kundi yung mode of initiation niya should be orally. Bakit? Kasi the mode of transmission ng polioviruses, for example, in this case, nag-initial replicate sila sa pharynx and gut or sa lymphoid tissue. Kaya, ginagaya ng Sabin vaccine class kung ano yung course of infection ng polio. Okay, take note with that one class kung ano yung kaibahan ng Sabin vaccine at saka ng Salk vaccine. Okay, ulitin ko class, ang Salk vaccine, sa yung nauna class, si Salk vaccine yung nauna, 1954, tapos inactivated vaccine naman sa class. Okay, tapos injected na yung mode of introduction niya. Compare with Sabin, Sabin was actually produced after Salk, and it is attenuated vaccine and given orally. So if you can observe in the picture class, so if the enterovirus may enter via aerosol or via ingestion, so may replication muna with the oropharynx and or tonsils, including with your lymphoid tissues. Then after that one, pwedeng magkaroon ng primary viremia. Ibig sabihin ng viremia class is pagkakaroon ng virus sa dugo. Tapos, kung magse-circulate na class, then pwede na tayong pumunta sa secondary viremia. Sa secondary viremia naman class, this is where the virus go to its specific organ. So, for example, pag polio at saka Cox, or Coxsackie virus, or Coxsackie viruses, so sa brain yung target nila class, then therefore it can cause encephalitis and paralysis. Compare with your echovirus, also with your polio at saka Coxsackie virus, they can actually go to meninges and cause meningitis. For hepatitis A, so target naman niya class is liver, so therefore can cause hepatitis A. For echo and Cox A, for erythema can actually target skin and then cause a hand, foot, mouth disease and or rash, hyperangina. And then for your echo, viruses and Coxsackie A and B, for muscle, then can cause your myocarditis, pericarditis, and pleurodermitis. So therefore, class enteroviruses have the same portal of entry. So either by aerosol or ingestion. And then, pupunta sa dugo as a primary viremia, then magkakaroon ng secondary viremia kung saan pupunta na sila sa target organ nila. Pwedeng brain, meninges, liver, skin, and or muscles. So viremia can result in the virus spreading to the spinal cord, heart, and skin, as I mentioned earlier. So the poliovirus tend to infect the nervous system and can cause paralysis in a small percentage of infected patient class. The virus destroys their host cells in the intestines. Damage is temporary because the cells lining the gut are rapidly replaced. Okay? So if you can observe in the picture naman class, so you have your oral ingestion of your poliovirus. That's your poliovirus class. This one. Okay? So this one is your poliovirus. And then, they will try to infect the alimentary tract. Yan, papasok siya dito class. And then, will go to the blood circulation. Tapos, pag nakapunta na siya sa blood circulation class, pwede siyang mag-cross because the virus is capable of crossing your blood-brain barrier, BBB. Tapos, pag nakakross na siya sa blood-brain barrier mo, then can go to your central nervous system. And then, they can replicate the virus and then can actually cause paralysis. Yan. So, dalawang pwede nating daanan class, pwedeng skeletal muscle pathway and or neural pathway. So, in contrast, neurons are not replaced. Okay, in this statement class, if you can observe in the previous slide, yung sinabi ko, temporary lang yung destruction pagdating sa gut. Bakit? Kasi the cell linings is replaced rapidly. However, ito yung binanggit ko na ngayon class, that in contrast, neurons are not replaced. So, neuron death can result in permanent paralysis. Ayun. So, no vaccines are available for enteroviruses other than your poliovirus. So, good personal and also nosocomial hygiene, and good sanitation can reduce the incidence of the infection. So excellent poliovirus vaccines of either attenuated or inactivated viruses are available. As I mentioned in the previous slide class, we have two types of your polio vaccines. You have your attenuated or Sabin vaccine, inactivated Salk vaccines. Since 1988, the polio vaccine has been crucial to the WHO's effort to eradicate polio worldwide. Sabi din ni Jonasal class, it's a good reminder for us, especially you students, that there is no such thing as failure. So there's just giving up too soon. So therefore, class, I know mahirap yung medtech, especially in these times na online. So you need to pray for a harder back, not for a lighter load. Yan yung always kong sinasabi before class when I was a student. So Lord, I pray for a stronger back, not for a lighter load. So anong ibig sabihin nito class? So pag medtech kasi, every time na proceed ka into next level, the load will become heavier. So you cannot actually control that one. So what you can control and what you can do as a student is to have a stronger back so you can carry all the heavy load. Yun, sabi pa ni Jonas Salk yan. So, enteroviruses can be cultured from the pharynx immediately before the onset of symptoms and 1 to 2 weeks afterwards. Okay, so possible pwede kang kumuha ng sample from your pharynx. Then they can be isolated from the feces or as long as 6 weeks afterwards. But during the time na madaming polio class, the best sample will be stool or feces. So if you can observe in the picture class, okay, this is the uh, uh, cause ng class poliovirus, that's paralysis. So since neurons yung involved, so permanent sa class. Yan. Kaya with the use of Salk vaccine, so the number of cases ng poliovirus drop. So specimen from the throat, feces, and rectum, CSF, and conjunctiva are recommended. Yan. So, but in clinical laboratory before, feces and or stool is the most, is the most common naman sa class. Yan. So enteroviruses have no group antigen, so they must be identified individually by a serum neutralization test. I hope that in your serology laboratory in our lecture, the serum neutralization test is explained already. So however, I will try to explain in a virological perspective. So serum neutralization test, as we know in the title itself pa lang ng test, neutralization. So kailangan daw i-neutralize yung virus, and we all know that viruses are proteins, so therefore they are antigen. So how can we neutralize the antigen? By using your antibodies. So if you can observe your class, you have your set of tubes with the different concentration of your antibodies. So tandaan class, enteroviruses have no group antigen, so they must be identified individually. Take note class that your polioviruses, meron tayong 1, 2, at saka 3. So for example, you want to identify your poliovirus 1. So therefore, you need to have your poliovirus 1 here class antibodies. Okay, specific only to identify your poliovirus 1. Okay, so hindi siya pwedeng maka-identify ng poliovirus 2 and or 3 or maka-interact. So for example class, this one is your poliovirus 1. So therefore, pag mag-interact yung antigen at saka antibody mo class, meron tayong tinatawag na neutralization. So pag na-neutralize na yung class, ang ibig sabihin niyan na dikitan na niya lahat, 'di ba? Dikitan na niya lahat. So if you can observe on the two, this is best example na na-neutralize na ni antibody si antigen. So ngayon mag-a-add ka ng cells. Okay? Specifically enterocytes kasi yun yung target cell ng polioviruses mo. Tapos, for example, this is your enterocytes, tapos nilagay mo siya dito. Does the virus can infect the cell? No class. So tama. If ang CPE mo is negative class, therefore the result is positive for poliovirus 1. Naintindihan? Ayun. Okay? So, if kung may tanong, you can actually review this one again and or either ask me for clarifications and to your serology lec and lab professors. Then, let's move to your hand, foot, and mouth disease. Okay? Your hand, foot, mouth disease is caused primarily by Coxsackie virus type A5, 10, 16, and occasionally enterovirus 71. Okay? It is spread by fomites or the oral fecal route. So, your hand, foot, and mouth disease is generally a disease that causes or occurs in young children. So, hand, foot, and mouth disease have a mild-prodromal phase, and that includes malaise, headache, and abdominal pain. Small painful sores suddenly appear on the tongue, buccal mucosa, and soft palate. If you can observe in this one class on the picture. So, I want to explain the term prodromal phase. So, prodromal phase class, it's the symptoms before the main symptoms. Ayan. So, for example, kanang ma-feel good nimo class na ala murag masakit ko. Kanang hala murag kalinturahon ko. So those are your prodromal phase. So I always explain this one to my class before when I was teaching na if the main symptoms is raining or rain, so ano yung prodromal phase niya? 'Di ba dag-o, makulimlim, kay lightning. So those are your prodromal phase class in a simple term and explanation. Simultaneously, a macropapular rash appears on the hand, feet, and buttocks, followed by a bullae, which is a bulla, on the soles of the feet and palms of the hands. So, a bullae clarosabula is a fluid-filled sac or lesion that appears when fluid is trapped under a thin layer of your skin. It is a type of a blister. Okay, bullae, okay, pronounced as bullae, is the plural word for the bulla. So, to be classified as a bulla, the blister must be larger than 0.5 centimeters in diameter, and smaller blisters are called vesicles. I know that you learned this one already in your bacteriology, okay, because I remember when we discuss your erythema and exanthems, we actually classified and or discuss the different types of your blisters and or vesicles pagdating sa Staphylococcus aureus. So, if kung nakalimutan nyo na class, please review kasi the different types of your exanthemas will be probably lalabas sa board exam. So, the virus can be isolated from specimens from swabs of the mouth and bullae. Then Coxsackie virus A16, they grow on your PMK and human diploid fibroblast cells and can be identified by serum neutralization test, which is the same with your poliovirus. Then let's move to your hepatitis A. Okay, it is a small icosahedral naked single-stranded RNA virus, the sole member of the genus Hepatovirus in the family Picornaviridae. Sorry class, Picornaviridae. You have your hepatitis A virus is the most almost always transmitted by oral fecal route. Okay class, your hepatitis A virus, ano ang other name natin yan class? You have your enterovirus 72. Tadan. You know other name niya class. Okay? So for these factors include sexual or household contact with an infected person. Pwede ding daycare contacts class as the hygiene is not too good, foodborne since the transmission is oral fecal route, or waterborne outbreaks or with the use of your IV drug, and international travels. Because there are some areas that are highly prevalent ng hepatitis A, and that includes Philippines. So the virus is shed in large amount in the feces during the incubation period, approximately 1 month. So if you can observe here, class, the incubation period, dito class, the incubation period naman class is 0, 1, 1. Ito yung incubation period. Tapos, ang mangyayari class, mag-i-increase yung ano natin, mag-i-increase yung ALT natin class as a response for the incubation period kasi nakapasok na lahat sa hepatocytes. Tapos pag nakapasok na sa hepatocytes, syempre yung response ng liver is your ALT increase. Ayan. Tapos, magkakasabay na din yung IgM natin class na titer. Tapos later na for 2 months, approximately 2 months naman, magproproduce yung IgG mo class. So if you can observe on the class, this one, hepatitis A can be neutralized with your antibodies, okay, specifically with your immunoglobulin G, because as habang patagal ng patagal, nag-i-increase naman yung production ng antibodies natin class. After individual are infected, they experience a transient viremia, after which the virus reaches the liver and replicates in hepatocytes. Kaya if you can observe, again, yun, in-explain ko na naman, para malaman natin, class, na the virus is successfully infect your hepatocytes is the liver marker ALT. So it's a self-limiting with a convalescence possibility lasting weeks and low mortality and no persistence, and it does not cause chronic liver disease compared with your hepatitis B. The best method for laboratory diagnosis of your hepatitis A virus or enterovirus 72 is the demonstration of your IgM to hepatitis A virus. So if you can observe, pwede kang mag-test ng hepatitis A mo pag IgM even as early as first month kasi increase siya. Yan. Siyempre, yung pasyente pupunta sa laboratory. Tapos, yung una mo makikita muna ALT. Pag increase ang ALT, siyempre, sasabihin mo, hala, ano kaya to? Bakit kaya mataas yung ALT? Bacteria ba? Ang bacteria naman, wala namang masyadong bacteria that infect and or affect your liver. Pag fungi, wala din masyado. So, possible, chemicals and or viruses. So, pag chemicals, madami ka kailangang i-run. Pwedeng exposure, pwedeng health-related. Kung wala naman, pwede mo lang i-rule out for viral infection. So, pwede mong i-run for your, yung pinakamura, you have your IgM. So, pag tinest mo, syempre, pag mag-i-increase na dito yung ALT, syempre, pag nag-test ka na ng IgM, magpa-positive din siya. Ayan. So, best sample for demonstration of your IgM pwedeng sa blood kasi may viremia na, andito yung virus natin class, and or antigen naman testing pagdating sa stool. So, we are done with your Picornaviridae class. So, we will move to your Calliciviridae class. Okay, under your Calliciviridae, you have your noroviruses. Noroviruses class are small, single-stranded RNA, round virus of 27 to 30 nanometer in diameter. As I mentioned, these viruses are currently placed in the genus Norovirus and a family Calliciviridae. So the most common cause of infectious gastroenteritis in the United States class, accounting for as many as 23 million cases annually. So you have your norovirus class. Transmission is most commonly foodborne, although waterborne and person-to-person transmission can be significant. So yung pinaka-common naman class pagdating sa noroviruses are shellfish. Ito naman yung pinaka-common natin class. Ako nga class, usually pag may nakikita akong shellfish, dalawa lang always kong naiisip. So either it's a norovirus and or Vibrio species. So the incubation period between exposure and first symptoms, we discussed this one in the previous slide already, is 24 to 48 hours. Imagine class, ang bilis, diba? So pag nakakain ka ngayon, within 24 to 48 hours, it can actually cause symptoms already. And the onset of severe nausea, vomiting, diarrhea, and low-grade fever. So the infection rate can be as high as 50%. So ibig sabihin yan, class, pag infected ka, you can actually transfer the virus to another people, 50% chance. So immunity may be short-lived, so leading to the potential for multiple infections throughout life. So ano ibig sabihin, class? Okay, pag sinabing immunity may be short-lived, so ibig sabihin ng class, our body produce antibodies and or immune system that will try to regulate the norovirus. However, short-term lang siya. So pag na-infect ka na naman ulit, then your antibodies are not there anymore. So therefore, meron siyang potential multiple infections throughout life. And we will move to your Baltimore's classification. Group number 4, pero envelope na class. If you can observe in the previous slides, we discussed all your naked viruses. And now we will discuss your viruses that have envelope under your group 4 Baltimore's classification. At isa sa mga pinaka-importanting virus dito, class, is you have your dengue. Yan. Okay? So, there's a dengue vaccine available in 2015. However, nagkaroon tayo ng problema. If you can still remember, madaming namatay with your dengue vaccine. So, these are the viruses under group 4. So, na-discuss na natin yung dalawang families class under your Baltimore's classification group number 4 na naked. So, you have your Picornaviridae at saka Caliciviridae. And pagdating sa group 4 na envelope naman class, we'll discuss your Flaviviridae, tapos si Togaviridae at saka si Coronaviridae. Yan, napapanahon kasi meron tayong COVID-19. Si Flavi class, andyan si dengue. Meron tayong type 1 to type 4. Tapos si Togaviridae naman class, meron tayong si chikungunya naman class, which is very, similar to your flavivirus in terms of clinical manifestation. And then coronaviruses. So this is the general replication cycle of our flaviviruses. They share the same replication cycle of our picornaviruses. So since flaviviruses are single-stranded RNA, positive sense class, they will try to encode, and they will try to not encode class, sorry class, they will try to inject their genome to the infected cell. Then since their genome is a positive sense, so hindi nila pwedeng gamitin kaagad as a polypeptide precursor. Bakit class? Kasi pag ginamit nila kaagad yung genomic RNA na positive sense, what will happen? Tama class, mauubos. Kaya anong gagawin nila? Gagawa sila ng complementary genomic RNA which is a negative sense. Tapos, pag meron na silang negative sense, what will happen? They will try to either use their own RNA-dependent RNA polymerase or gagamit sila sa humans. It depends kung anong virus yung class. Tapos, yung RNA-dependent RNA polymerase dadaan sa negative sense na RNA will produce a lot of many copies of the positive RNA class. Kaya positive single-stranded RNA or we call that 1mRNA class. Tapos, after 9 class, gagawa na sila ng structural and non-structural proteins. Tapos, that includes for the assembly. And then, after, babalik na siya for the genomic RNA. Kasi positive sense naman din sa class. Ito, positive sense naman din siya. And then, after nyan class, gagawa na siya ng new progeny of your virus. So, the family Flaviviridae contains a number of important human pathogens, many of which are zoonotic arboviruses that include Japanese encephalitis virus, dengue virus, yellow fever, St. Louis encephalitis virus, at saka West Nile virus. So, lahat ng limang nabanggit class, they are very famous in the world of virology. Specifically, pag zoonotic yung topic natin class. Okay? So, syempre, pagdating sa humans, yung ito din class, sa humans, ito din lima. Okay, pero yung sa Philippines, yung pinaka-common talaga natin class, you have your dengue virus. So dengue virus can cause two distinct disease. So you have your classic dengue fever, we term that one as DF, or dengue hemorrhagic fever or DHF. We'll discuss that one later, specifically kung ano yung dalawa. So dengue has a 4 serotype. So meron tayong dengue virus 1, 2, 3, and 4. So the virus is transmitted by Aedes mosquito, including your Aegypti and albopictus. Okay, class. So patient with dengue fever, DF, develop fever, headache, myalgia, and bone pain resulting in the nickname breakbone fever. So pag may mga pasyente, di ba class, if we will try to relate it kung yung mga pasyenteng merong may dengue fever, they always say, sakit ang kasukasuhan, like sa mga bones class, because that's a hallmark characteristic of your dengue fever. Some patients also develop rash. So although your dengue fever is a mild disease, your dengue hemorrhagic fever is not. So patient develop the dengue hemorrhagic fever after they have already been exposed to one of the other 3 types class. So ano yung requirement para magkaroon ka ng dengue hemorrhagic fever? Tama class. Dapat na-expose ka muna ng kahit ni isa sa 1 to 4 na dengue virus. Bakit? Kasi we will explain that one in the next slide. So we have exposure to 2 different serotypes of dengue virus appears necessary for the development of your dengue hemorrhagic fever. Kasi patient with dengue hemorrhagic fever develop the symptoms of classic DF. Then long with thrombocytopenia, hemorrhage, and shock, then sometimes death. So ito yung nangyayari class. In a natural cause, so you have your macrophage, class monocyte pa rin nandito. So the monocyte have the FC gamma receptor. So ibig sabihin class, merong receptor yung monocyte for the FC portion ng immunoglobulin G. Tapos, what will happen? Antibodies will bind with this one, tama? The IgG will bind to the virus. Pag nag-bind na siya sa virus, kukunin ni monocyte yung wet part ng antibody. Tapos, kakainin niya class. Of course, kasi ang function ni monocyte can actually engulf. Tama? Tapos, pag na-engulf na niyan class, what will happen? Ito. Tapos, the virus can actually survive inside. So, if the virus can actually survive inside class, then it can actually produce or increase the viral load. Pero pagdating sa class, sa dengue hemorrhagic fever, kasi di ba kailangan siya dalawang exposure ng strains muna because we have the antibody-dependent enhancement or ADE. So ganito yung initial infection with dengue virus class. So yung dengue papasok sa cell. Tama? Pagpasok sa cell, mag-produce. Tama? Kung mag-produce siya, siyempre sa T cells and B cells will produce antibodies that will try to neutralize the virus. Tapos after mag-neutralize, what will happen? Macrophage will try to engulf that one kasi sa macrophage meron din siyang FC gamma receptor. Okay, tapos pag kinain na yan, what will happen? The virus will be destroyed. However, in the second infection with different viral types, so dito class type 1, dito naman class type 2 for example. So pag yung sa type 2 naman class, pag merong red naman yung virus, diba? Dito. Ito yung type 1, yung type 2 blue. Yung type 2 blue naman class, ito. Halos magkawig kasi si type 1 at saka si type 2 na dengue. So what will happen? Your antibodies will try to release antibodies for your dengue type 1 kasi magkahawig sila ni dengue type 2. Tapos, kaso lang si antibodies na na-produce na which is dengue type 1 which is weaker in terms of neutralization. So what will happen class? Kakainin ng macrophage tapos pag pasok sa loob, since the antibody is weaker, so natatanggal sa kaagad class, then the virus can actually survive inside the macrophage, tapos dadami siya. So anong function ng antibody? Dito class, tama, 'Diba? Tumulong lang si antibody class na makapasok si virus sa loob ng macrophage. Ayan. So, ang galing na antibody class. Kaya siya tinawag na antibody-dependent enhancement. Kasi ini-enhance ng antibody ang pagpasok ng virus sa loob ng macrophage. Kaya mas mabilis yung development ng dengue hemorrhagic fever compared with the dengue fever. Then we are done with your Flaviviridae class, which is your dengue viruses, type 1, 2, 3, and 4. So we'll move to your Togaviridae class. The family Togaviridae contains the general alpha virus, rubivirus at saka arterivirus. Many of the viruses in the genus alpha virus are mosquito-borne and cause encephalitis. So if you can observe class with chikungunya, okay, chikungunya is very popular in the Philippines also class. Now kasi they produce the same clinical symptoms pagdating sa clinical symptoms same with your dengue. So your chikungunya is Togaviridae under the genus Alphaviruses. Compared with your dengue, Flaviviridae naman siya class genus Flavivirus. And then you have your Eastern equine encephalitis or EEE virus. They occurs primarily in the eastern half of the United States. Infection have a significant mortality rate of about 36%. So, aside kay under kay Togaviridae class, so andun si chikungunya, isa din dun si Eastern equine encephalitis. So sa Philippines naman, class, very low yung case and or none ang Eastern equine encephalitis because this virus is considered geographically restricted. So ibig sabihin, class, meron lang mga area kung saan highly prevalent siya. So as many as half of those who survive the infection suffer permanent CSF damage. Ayun. And then bird are the natural reservoir of the virus and it is spread to humans and horses by a bite of mosquito. So the mosquito will serve as your vector class. Yan. So your bird will serve as your amplifying host naman class. Tapos dead end host naman si human class and or horses. Kung merong Eastern, meron din tayong Western equine encephalitis virus or WE virus causes milder diseases than E virus. 30% of infected children and infants will suffer permanent CNS damage. So mortality rate is about 3% lower than compared with your E virus. And since 1964, there have only been 639 cases in the United States. So QLEX at saka Aedes naman yung pwedeng gawing vector naman ito class. And syempre, you have your rubella virus, okay? See, it caused the disease rubella or German measles, a mild febrile illness accompanied by erythematous maculopapular discrete rash with post-auricular and sub-occipital lymphadenopathy. Yan, class. So, yung post-auricular, yun yung nasa ear mo, class. Tapos, yung sub-occipital class, ito yung parang sa mata mo nagpupush. Okay, that's your lymphadenopathy. So, German measles class is caused by a virus called rubella virus. So, the rubella virus is transmitted by droplets, class. If you can observe the difference between your large infectious droplet, ayan, class, and then small infectious droplet compared with your droplet with nuclei. Usually, infectious droplet nuclei class are airborne because they are very small and then can actually spread far compared with your large infectious droplet and then small infectious droplet. And then the virus is present in nasopharyngeal specimens or any secretion or tissue of infected infants. Tingin ko lahat naman tayo nagka-rubella virus, di ba, class, or German measles? Kung wala, ikaw na ang masyadong healthy and or walang masyadong exposure. So, a rash starts on the face and spread to the trunk and leaves class. So, ito yung hallmark characteristic ng rubella virus. Kasi usually, the rash will always start on the face and then spread on the trunk and leaves. And take note ito class ha, paki-take note, paki-highlight class, no rash appears on the palm and soles. So, ano ibig sabihin nito class? Pag may rash ka appears on the palm and soles, hindi yan siya rubella virus. Okay? Kasi madaming viruses that can cause exanthema class and that this also include your rubella virus. Kaso lang, ang general characteristic ng rubella virus is that wala siya dapat rash sa palm at saka sa soles. As many as 50% of individuals with rubella are asymptomatic. So imagine class, you might be carrying the virus, not having the rash, but you can actually transfer that one to your family members and or friends. Kaya dapat meron tayong vaccine class. So, the rubella virus can actually cross the placenta of pregnant women and disseminate to fetus tissues in a condition referred to as congenital rubella syndromes. So, dapat ito yung pinaka, natin class, tandaan na pag may pregnant women, so dapat iwas siya muna sa exposure with patient and or people having the clinical manifestation for your German measles. So the impact on the embryo is worse when the infection develops in the earliest stage of the pregnancy because the virus halts or slows the growth of the cells in infant class. So imagine one virus can actually kill a living infant. So dapat ikaw, mother kayo, girls, future mother, dapat careful din kayo. May German measles yung dapat iwas ka na din. Not for yourself, of course, but for your future baby. Kaya class, the physicians, they usually suggest reproductive women na at least na-expose ka ng German measles prior pregnancy para less yung less yung natin, exposure to German measles. Pero kung wala, okay lang naman class. Why? Because we have a vaccine. An effective attenuated vaccine is available and should be administered to all children and young women before they will become sexually active in class. So, kung sexually active kayo class and then planning to have baby, so please be careful kasi pag hindi pa kayo experience ng German measles, then it would be very difficult for you to actually bear a child. Tapos, because the virus can actually kill the baby class. Yun yung point ko. Okay? So, yung vaccine naman natin class that includes your MMR. You have your measles, mumps, and you have your rubella. So, MMR. So, for us laboratory scientists, we have direct examination of specimens by immunofluorescence or EIA, which is recommended, and or serologic procedures are effective because any rubella antibody is presumed to be protective. So the most sensitive serological assays are the solid phase and passive hemagglutination test class. Paki-take note class, paki-highlight with this one. And then for the principle of this one class, please refer to your serology, laboratory or lecture discussion. Don't worry class, pagdating sa quiz or exam, hindi ko na may tatanong yung principle. Itatanong ko lang, for example, ano yung pinaka-most sensitive serological assay na ginagamit pagdating sa rubella viruses. So, sagot na lang naman natin din class is solid phase and or passive hemagglutination test class. Okay, take note with this one class ha, walang lalabas na principle pagdating sa exam in or quizzes. Then we will move to your Flaviviridae class. Okay, Flaviviridae. So under naman dito class, you have hepatitis E virus. Okay, so There are small 32 to 34 nanometer classified in the genus Virus, family Flaviviridae. They were classified before as Flaviviridae class, but they were removed kasi hindi sila belong to the family. Along with the hepatitis C virus, hepatitis E virus is the other historic non-A, non-B hepatitis virus class. Okay, take note with the term NA and B, non-A, non-B virus hepatitis class. So hepatitis E virus causes an acute self-limiting disease with the clinical symptoms that are similar to those of your hepatitis A virus. So the incubation period is 2 to 9 weeks. So the problem with hepatitis E virus class, which is not screened in blood bags, but however, once the blood is transfused to a person, especially with pregnant women class K, the tendency is that this can actually cause infection to the pregnant women and eventually cause death to the infant. So viral sheddings in the feces have been shown to persist for several months, and the mortality rate is 1 to 3% overall, with a higher likelihood of death in pregnant women. So 15% to 25%. One of my classmates during my master's class, she studied and evaluated all the blood bags in Manila and uh, identify if kung merong hepatitis E virus sa blood bags. And then sadly class, meron siyang nakuha. Di ko na memorize kung ilan yung prevalence niya class. Pero merong na-identify, which is very alarming. So one of the recommendations sa study class is that to at least include hepatitis E screening in blood bags. ELISA test has been developed to detect IgG and IgM antibodies to hepatitis E virus. Yung na-mention ko na study class with my classmate during MS, yung gamit niya class is ELISA test. So, ginamit niya IgG at saka IgM para ma-screen talaga if mag-miss sa IgM, meron tayong IgG. Meron kasing mga possible class na mag-miss sa IgM tapos magpa-positive sa IgG. Hepatitis E virus testing is not currently performed in diagnostic laboratories in the US and even in the Philippines. And now we are down to the last virus of your single-stranded RNA virus Baltimore's classification group number 4, which is your Coronaviridae. And we have your coronavirus class. They have distinct lab-shaped projection on their surface, and then it is responsible for 15% of cold-like infections in adults, but higher seroconversion rates are seen in children. So the coronavirus class here, the corona, highlight natin class. Paano ba i-highlight to? Ito. Okay, the corona class here is not the corona that we usually think na crown. Ito. Okay, the corona here class is when the sun, ito daw class, so merong sun. Yellow ang sun, diba class? Ayan. Tapos, merong eclipse. So, kung mag-eclipse, merong brown. Tama. Brown-black, sorry class. Yan. Tapos, pag may black, di ba merong shade dito? Ito yung yellow, yellow or ganito yung shade niya class. So, ito yung tinatawag na crowning. Kaya siya tinawag na coronavirus. Ayan. So, hindi siya ito dahil meron siyang crown na ganito. Looks like this one. Okay? So, yun yung reason bakit siya tinawag na coronavirus. So, coronaviruses are extremely fragile, of course, because they are enveloped and difficult to culture, but it is possible to test specimens directly by immunofluorescence and enzyme immunoabsorbent methods. But in our laboratory class, we use culture to identify coronavirus. So a novel coronavirus was the causative agent of a pandemic respiratory disease that emerged from Hong Kong noong 2002. So during 6 months period, the infection spread rapidly to 26 countries in Asia, Europe, South America, and North America class. Tapos hanggang 7 months lang naman nag-last yung coronavirus 1 noong 2002. And then nawala na siya class. So mortality rate of your coronavirus is approximately 10%. So disease was characterized by high fever, pneumonia, and in some patients, acute respiratory distress syndrome. So the disease was named severe acute respiratory syndrome or SARS, and the causative agent was designated as SARS-associated coronavirus or SARS-CoV now 1. Kasi meron na tayong SARS-CoV-2. So, for coronavirus SARS-CoV-1, no vaccine or antiviral agent was available to fight the pandemic, which is ultimately ended with an intense public health intervention, including massive screening programs, voluntary quarantine, and travel restrictions. So, coronavirus that jump from, its normal animal host and possibly a civet cat into human. So, that is for your coronavirus 1. So, in the next slide class, papakita ko yung tatlo. So, ito yung tatlo class. So, you have your natural host for bats and intermediate host for your civet cat nung SARS-CoV 2002. 2003 natapos class. 30 countries were affected. 774 lang yung death. Sa MERS-CoV naman class 2012, Saudi Arabia, 27 countries yung involved, 850 yung death. Camel naman yung intermediate host. Tapos, yung sa intermediate host naman class, later papakita ko kung ano yan, who's that Pokemon. Ayan, for SARS-CoV-2 2019, Wuhan, China naman yung place, 143 yung countries involved, and then, as of this date, yun lang yung first 1 week class, that's 5,734 deaths. After declaring the virus SARS-CoV-2 2019. So, yung intermediate host ng SARS-CoV-2 naman class, you have your pangolins. Possible class, pangolins. Meron naman din tayong pangolin sa Pinas class. However, hindi natin kinakain. Compare with China, yung meat kasi ng pangolin is kinakain sa class. And then pangolins are very famous in China because it contains chemicals that are known to cease or halt cancers. So, the discovery of multiple lineage of pangolin coronavirus and their similarity to SARS-CoV-2 suggests that pangolin should be considered as possible host and should be removed from wet markets to prevent zoonotic transmission. So for the classification class, okay, we'll start with the order, Nidovirales, then family Coronaviridae. Tapos meron tayong 4 na genus, Alpha, Beta, Gamma, at saka Delta viruses, which is very nice pagdating sa mga human viruses na corona kasi under one genus lang sila, Beta Coronaviridae. Beta coronaviruses. So, sa lineage naman, class A, B, C, and D, sa lineage, isa lang din sa class B lineage, andun si SARS-CoV-1, MERS-CoV, at saka si SARS-CoV-2. So for the structure, ito yung itsura niya class. If you can observe with this one, the SARS-CoV-2 virus. Tapos with the use of your spike proteins, kakabit sa host cell, angiotensin converting enzyme 2. Ito naman class. Okay? Take note naman dito class. So for infection, of course, the virus will be inhaled and then go to the lungs class with the use of your spike protein and ACE2. Tapos papasok siya, then can actually trigger immune response, and then the immune response will try to neutralize that one. However, the virus can still survive. So nagkakaroon ng disease progression. So coronavirus class, they use electron microscope pero masyadong mahal pa ng ELISA. Pagdating class sa coronavirus 1, wala pang ELISA sa coronavirus 2. RT-PCR coronavirus 1, RT-PCR din sa coronavirus 2 at saka sa MERS-CoV. And then antibody can be detected by Western blot together with your MERS-CoV at saka coronavirus 1 at saka coronavirus 2. So for coronavirus 1, no SARS vaccine. However, trials with an intranasal immunization and or UV formalin inactivated vaccine have shown potential pero walang na-produce na coronavirus 1 or COVID-1 vaccine. However, pagdating sa COVID-19, meron tayong different vaccines class. So these are the different vaccines class that are available in the Philippines. So you have your Pfizer, which is the RNA vaccine. And then you have your Oxford AstraZeneca. Okay, that's your viral vector with the use of your adenovirus as a vector class. And then you have your Sinovac inactivated. And then viral vector naman class, si Gamaleya Sputnik sa Russia. Bharat Biotech naman class, inactivated siya na vaccine. Moderna, RNA vaccine, Novavax for subunit vaccine, at saka Janssen's for the viral, gamit naman niya class viral vector. So for the vaccines, I hope that the immunology will discuss this one. But for virological purposes, I will just like include this one class para at least alam ninyo that we have a different vaccines available in the Philippines. And we are now done with your Group 3 and Group 4 RNA viruses class. So masyadong lengthy, umabot tayo ng 1 oras to discuss this one. If you have some questions, please don't hesitate to beat me up. And I really apologize class with the technical problem since nasira talaga laptop ko. Wala akong laptop for a week. So I'm still waiting for my file to be extracted because it will take time, and then I need to make my own PowerPoint again. So I really apologize. So I hope that you really understand class my situation, and then good luck with your quiz, and ilang konting push na lang class, 2 weeks na lang, and then we are done with your mycology virology subject, and then you will become a mycologist and virologist. Again class, if you have some questions, please don't hesitate to beat me up. Ja, matane.